Hello there everyone and welcome to this Neurological Music Therapy programme. I'm so glad that you found your way here. My name's Kellyanne and I'm a speech and language pathologist or speech and language therapist, depending on where you're from. I've been a speech and language therapist for about 15 years now. I originally studied linguistics under the direction of Professor David Crystal. And I loved language. I just studied the things that I enjoyed at school, and I loved linguistics and language, and I was very interested in what started to happen for people who didn't develop language in a typical way, or what started to happen to people if their language was affected by injury to the brain. And so that started to foster a bit of an interest there. And I then went on to study for a Masters of Medical Science in Clinical Communication Pathology at Sheffield University. And after 5 years at university, I came to Liverpool and started my first job here in an inner city hospital right in the city centre. I really had found my vocation in life, and I was so excited to get started after so many years of study, actually really applying the linguistics and the medical knowledge that I now knew. And starting to be a speech therapist was a real steep learning curve, but I loved it and I really had a passion for it. However, quite early on in my career, I started to notice that speech and language therapy on its own wasn't actually that effective for people who had very significant communication difficulties. For those that had the milder difficulties, like a small amount of dysarthria, a mild motor speech disorder, or a milder language impairment, speech and language therapy was really effective. And we have the research, we have the evidence base for that, and I knew that to be true. But my experience was that I was meeting people all over this inner city hospital with quite a wide range of communication difficulty. And for those that were very severely impaired, I suddenly found myself in a position where I didn't think I was going to be able to help them. And so I think I just started to get a little bit disillusioned by that. I'd invested so much already in this career choice, and yet there were people I couldn't reach. And so, undeterred, I went on to try to find some solutions for that. I wasn't happy enough. I didn't feel that was good enough for me, and I didn't feel it was good enough for the people I was meeting, that I really didn't have anything to meet them with to support them. So I went on a search and I went to London to the Neurological Hospital of Neurodisability, and I started to study under Professor Michael Tout, and he is the leading professor in what was called Neurological Music Therapy. And I thought, well, I will give this a go, because I've been a singer all of my life. I'm very musical naturally. And I wonder if music is the answer for these people that I see who are really struggling with their communication. And I just knew immediately that this music therapy was going to offer so much more. And so I quickly came back to Liverpool and started to apply this music therapy to the people I met. And I noticed some really clear differences. Well, first of all, I noticed that if you say to anybody, do you think you could sing for me? Usually people sort of react a little like, oh, me? Oh, I don't know. So often the response to neurological music therapy at first is a little bit mixed. But in actual fact, the truth is that we are all very, very receptive to music. Let me tell you that even when we're in the womb, we are hearing rhythm. We're hearing the beating of our mother's heart. We're hearing the beating of the blood flow through the placenta. And we're in an acoustic chamber of sound waves all around us. Even when we're in the womb, we're hearing our mother's voice from outside of the womb. And when we're born, we're immediately exposed to sounds and voices. So music and sound and acoustics, we're exposed to it straight away. And there is nobody, I believe there is nobody who hasn't heard some music. And so it's as though we are predetermined to use music. And I learned that if you're suffering from significant difficulties with your brain, that we can utilise that music to help us with communication. So after the initial, seeing the first few patients and saying, would you like to sing for me? And them saying no, I kind of just learnt ways in which I could integrate a little bit of singing and find out who their favourite artist was. I'd sing them a song. I'd go first before them and say, what do you think of this? And often, music makes us smile. Music brings back memories. Music makes us think of happier times, certainly happier times for these people in hospital beds at the time. And I started to notice that there was a much quicker response to neurological music therapy than I could get to speech and language therapy. When you're not feeling fantastic, often you don't want to get engaged in therapies, and we do see that in acute hospitals. Sometimes people are a little bit further down the rehabilitation route and they just don't want to do therapy anymore. Maybe they're feeling as though they're not making progress, or they've tried the therapy but they can't keep up their motivation with it. And so neurological music therapy really does offer us something different. And you may well have come across this program because, like those people, you've tried speech and language therapy and you've not had much success. Maybe even like many of the people I meet in my clinic, you have met people, other health professionals, who might have told you that there is no hope. They may have told you that you're at where you're at as a result of injury to the brain and you're not going to progress. And I want to tell you that in the last 15 years, many people have come to me with that story, and yet I have never met a single person that I couldn't assist or at least move forward with the application of music and combining that with speech and language therapy. So I want to congratulate you for finding this course, for finding the right help, and just for starting to get inquisitive about how music really could assist you in your communication journey.